Thank you for joining Congressman Mark DeSaulniers' virtual countdown to a Republican shutdown town hall. My name is Janessa Oriel, and I'm the district director for Congressman DeSaulniers. Tonight, you'll hear from the congressman about the current status of government funding ahead of the funding deadline in just 3 hours, and Democrats' efforts to protect Americans' health care and to keep government open. We'll then take questions live. To ask a question through Zoom, please submit it through the Q&A box at the bottom of your screen. And to submit questions through YouTube, please add your question to the comment section. I will now turn the town hall over to Congressman DeSaulniers.
Thanks, Janessa, and thank you all for joining us. It's 9 o'clock on the East Coast. I am in my office here on Capitol Hill, speaking to you from my desk in the Rayburn building across the street from the U.S. Capitol. So we put this together to try to give you as most recent information that we have available right now. So we'll do a PowerPoint. So I'm sorry it has to come to this, but I think this is a necessary step to try to get our colleagues and to work together for the greater good. So we obviously are very divided as a country right now, and this is just another example of that. So 3 hours from now, when the clock hits midnight, the government will shut down, and we'll talk a little bit about what that means. Next. All right, so this is how separated the country is. I suppose we're close, but we're very evenly divided in both houses. We have one new member that as soon as the Republicans will allow it, and they're here, she will be sworn in. This is for a vacant seat for Rao Grijalva, who is the ranking member and chair of the Resources Committee, who passed away of cancer. His daughter just won a special election, so we would like to get her sworn in. But given that the Republicans, Speaker canceled these 2 days for the full House to be in, to put more pressure on the Senate and Senate Democrats to pass their continuing resolution, which every Democrat, including myself, voted against a few weeks ago. So very evenly divided. Next. So this is my view of the mismanagement. I believe strongly that fiscal responsibility, whether you're a Republican or a Democrat, should be something that is practiced. It's best for everyone. It's best for our credit. The US dollar is the currency of the globe. So people rely on us because we're in such a big economy, and because traditionally our currency reflects both the size of our economy, but also some level of stability in terms of the globe feeling like it's a stable currency. This kind of deviating from the normal budget process erodes that. So it once was a time where you would certainly argue about investments in government, but you'd work on the policy committees on a policy, and then of course you'd have to appropriate the funds on appropriations budget and ways and means on how you would do all that. So for the average voter, the legislative bodies to a large degree separate policy committees from fiscal committees. And historically that was a good policy, I think, because it got us to focus on better fiscal management. And then on the policy stuff, you would debate it, and of course you knew it would have an effect on the budget side. And the Congressional Budget Office here and the legislative analyst in California did a very good job of being sort of the arbiter of how they analyze the funding. One point is that this budget process has also been late. My last town hall, and if you're interested in that, you can go back to our PowerPoint from the town hall we just did on the budget process and how broken it is. But it's been late, and CRs have been the rule of thumb since 1977, and it got particularly worse in 1994, the year of Gingrich's contract on America. That's my language. And then this time, President Trump was late by a quarter of the fiscal budget year and even submitting his budget. So it starts with the president submitting what he would like to see in the budget, and then the clock runs on that until September 30th. the fiscal year. So we have been unable to do that for quite a while. And they haven't gone through the appropriations process. They're in charge of appropriations committee because they're the majority. Those appropriations hearings are ongoing, and will be ongoing when we come back next Tuesday. The full house is scheduled for next Tuesday. Next. So again, they haven't negotiated with us. Normally, there's a back and forth between what's called the four corners, Republican leaders and the Democratic leaders in the two houses, the speaker and the minority leader, and the president of the Senate and the minority leader, Speaker Pro Tem. In the Senate, that hasn't happened. They've pretty much shut us out. It's been driven, I think, largely by the current president, who this is the way he negotiates apparently. But doesn't give us a good give and take. It fails to avoid steep hikes in health insurance premiums for all Americans, loss of healthcare coverage for millions, and hand even more money to tax cuts in billionaires. Now, these are in different vehicles. The Republicans will argue this is what's called a clean resolution, but you have to take into effect that the big ugly bill had huge budget consequences for what we already passed. So they took the budget that had been appropriated last year in fiscal year into this fiscal year, and they cut that, cutting $500 billion in funding for Medicaid, cutting SNAP, the Supplemental Nutrition Program, both of which have been very vetted over the years and have worked from a fiscal stewardship position. So this particular bill, and our opposition, my opposition, has a lot to do with what they've already done since January 20th, when the current administration came in and decided to do the rules much differently than it's been done in most of American history, at least modern history. So those cuts in insurance premiums will affect millions of Americans. And that's why I think it's really important not to do it now. Republicans will say, well, we can negotiate those because they happen at the end of the year. But since they've already cut Medicaid and had a huge impact also to the private health insurance, non-Medicaid, Medicare, and California is called Medi-Cal. That goes through the committee that I'm the ranking member in when I'm on the Education and Labor Committee, the Health, Employment, Labor, and Pensions. That subcommittee deals with the employer-employee healthcare, which is a lot of course. Those rates we've already seen, and we've had bipartisan hearings when I was chair and as ranking member about denials, about PBMs, about a lot of the inefficiencies in the system. And we want to get at that. Health insurers are denying a lot of claims they historically have accepted. At the same time that the Republicans have cut the oversight for the people who respond to claims and denials. So we have one investigator now here in DC, well, nationally, to investigate every 17,000 health plans. So we've had hearings on that as well. So this is just health insurance affordability, sort of continuing the previous slide. The premium tax credit is a big part of this. Those were in place since the Affordable Care Act was passed under President Obama, but they were increased, as you see in the third budget, as part of the Inflation Reduction Act. So this helps everyone, and it's capped. So there are fiscal constraints on this. Without further action by Congress, the last bullet, the enhanced premium tax credits will expire, as I said, the end of this year, making it harder for ordinary Americans to afford healthcare. And another part of that is the marketplace is already responding to this. So we can see rates going up for private health insurance, and we can also see the quality of care from a lot of the health insurers diminishing with the denials and making it harder for people to get their claims, doctors and patients be able to actually get their claims to have health insurance pay for their doctor's visits or any treatment they need. And I say this not just as a policymaker, but somebody who a lot of you know is a survivor of stage 4 cancer. A month in an ICU here in DC. I've had a lot of personal experience with the healthcare system. So next. Um, so all of this again is just moving us towards, if you don't believe me, I would recommend the Kaiser Family Foundation, very well respected nonprofit. Of course, Kaiser started in the East Bay. They do a really good job. Republicans and Democrats have always said they trust Kaiser, and the Congressional Budget Office also has. So you can go on to their websites and see what their nonpartisan evaluation is. Very well-respected institutions, both CBO and Kaiser Family Foundation. And on health, Kaiser really is, I believe, the gold standard. But it's going to be very hard. And as I mentioned in my earlier comments, that last bullet as a backdrop, the big ugly bill really put us in this position to having the healthcare crisis right on the precipice of causing real serious damage for Americans and the American economy. Remember that the health industry, all of it in the United States, is a fifth of the US GDP. So it's a very big part of how we should make sure we're sensitive to the effects of the economy. And if you can't get quality of care, you lose trust. And this is also in the framework of we spend the most in healthcare of any developed country in the world, and we have among the worst outcomes. So when you look at life expectancy, the number of serious diagnoses for a variety of reasons that have been studied thoroughly. And I have a lot of opinions about that, and we can do that at another town hall to go more into American healthcare. But the fact that we spend so much and our outcomes are worse is well recorded, and that's what President Obama and the Democratic-controlled Congress tried to do. My predecessor, George Miller, had a very large role in this as the chair of the Education Labor Committee. Remarkable piece of legislation. It's worked well, but we have a lot of work to do on our healthcare system. We, in my view, have the poorest healthcare system in the world in developed countries. We have great research, great doctors, but huge inefficiencies. And those inefficiencies largely are protected by the people who benefit from that. The Biden administration did a great job of reducing pharmaceutical costs, something that was in the news today about this president. But we dropped a lot of those costs. I mean, not why anyone would say that Medicare and Medicaid couldn't negotiate drug prices, which is a national outrage, since that's good stewardship. And we look at how other countries pay for their pharmaceutical costs, very different in terms of controls. The drug that keeps me alive from my chronic lymphocytic leukemia, most of the basic research was done by American taxpayers at the American Cancer Institute. I've mentioned this many times before in previous discussions. My pill, when I started it, developed almost entirely the basic research by Americans at the American Cancer Institute and the National Institutes for Health. Was about $400 a day. It's remarkable. It's now about $90 a day because of President Biden, and that's comparable to the EU, even though we paid for most of the research that created that bill. The Australians pay $37. So we were subsidizing other countries and other sick people. Next. So this is which part of the population will be most affected, and you can see people who don't make very much, and most of these people are working on the idea from the administration that they wanted to make sure everybody was working. Reports that we've gotten from Kaiser and CBO say up to 85% of the people in America are working full or part-time who are currently on Medicaid. So they're just not making very much. Can you try to imagine yourself trying to live on $25,000 a year and even be able to function and work? So you see where the premiums will go up the most. They'll punish people who can afford it the least. And where will they end up? They'll end up in the emergency room. So we're moving away from a healthcare system where we move to prevention, early intervention and research and good lifestyle choices by all of us: less smoking, less drinking, more exercise, taking care of yourself. So we're breaking that whole really correct healthcare model that still had all these inefficiencies, and now moving it back to when you're you'll get sicker and you'll go to the emergency room where the cost of care is the most. And of course, the mortality is the highest. And you can see where it's directed. It's directed at the poorest Americans, which is typical for the current majority party. By the way, a lot of their constituents in rural areas are going to be very impacted by this. So I don't know how they explain that back home, but we're hearing they're getting a lot of pushback from their constituents as they start to discover these things. Now, the Medicaid cuts don't go into effect until after the midterms, which is 2 years from now. So they cleverly thought that they could do this and then people would notice it and hopefully they would hoping they could not be held to the consequences of this decision in the big ugly bill until after the next election. So we're trying to point out to people that if you elect these people again, you're going to have real consequences. Now, we're already seeing the consequences as we speak, but that's the way they did this. So we're fighting back with everything we've got. Unfortunately, when you're in the minority, even by a small amount in this environment, it's very difficult. I work with my colleagues on the other side, but they're not working with us at all. A reporter asked me today, well, you have a reputation for working with people. You're very progressive, which was George Miller's model. I learned that from George Miller and amongst others. But I told that reporter, I said, well, every time we've tried to, they've moved the ball further away. So when you negotiate with some people who aren't negotiating in good faith, you tend to stop until they come back and want to negotiate. That's the unfortunate situation we find ourselves in. So we're fighting back. I always tell you, you got to get out and demonstrate on the streets peacefully and legally. And we've been doing that, I think, wonderfully across the country. And I'm particularly proud of what we've done in California to demonstrate our democratic rights to free speech, to say we don't agree with what's happening. But we do it in such a way that's legal and constructive, hopefully, and get people's attention, but you have to stay at it. And we fight in the courts because a lot of these things have been held by the courts that this administration has done to be illegal. So they get overturned in the courts. Last I checked, 97% of his initiatives have actually been overturned in the lower courts. And they're, of course, on appeal, but that process, due process, takes a long time. It's a lot of damage in the meantime. Next. So a lot of things you won't notice. You continue to get your Social Security check if you're eligible for that and getting it, Medicare. So if you're eligible for Medicare, Medicare is for seniors, obviously. For those of us who are aware of that, Medicaid is for people who qualify because they have such low incomes. So that's what we have as a social safety net. In California, it's called Medi-Cal. The VA has really had some hits, and our VA person in the district, a veteran, has really worked closely with veterans and has a lot of cases. And I know many of you who have contacted our office of veterans are proud of the work that we've been able to do for you. Former Marine Lance Corporal Brian Thomas Brown, and so the veterans. It's just harder. I'll tell you, since January 20th, it's been very hard for me to go up to the VA facility in Martinez in my district. In the past, I could give them a call the week that I wanted to visit, and they were thrilled to have me come. So, and we just go out there and talk to patients. And but since this administration took over, they make it very difficult for a member of Congress even to see our veterans facility and to meet with veterans to see how they're doing. So non-essential federal functions will come to a halt. So public safety, TSA, I've been asked about this, the FAA, they'll continue, but they'll be strained because all of this is obviously connected to other federal agencies. So it's going to put pressure on the system throughout. But most of those, public safety and continue to be functioning, although they will be going without pay. Many of them. So consider that. How do you do that as an employer and expect your employees to feel good about their jobs, and not to mention the pressure they're under? So, and lastly, we're hearing in the last few days from the administration and from the Office of Management and Budget that they're going to just start eliminating positions, people, fire them. And we don't believe that's legal. It's not, we will fight it, but it still puts people in a very difficult position, and they'll be stressed. So this is just unnecessary, cruel, and as I say, it is cruel. It's just awful. Um, People go into public service for a variety of reasons, having served at every level of government and have come from the private sector, running very small margin restaurants, but did it successfully for 35 years, managing and owning restaurants. Some of you still remember one in Concord, which I had the longest. But people in the public sector, they go for a variety of reasons, and almost all of them I've found to be really remarkable in terms of their duty to service. Is it always perfect? No. Big organization, different people, different, like all of us, different level. Every day we go into work, but they go in for security historically, not because of the compensation, and this takes that away. So we're losing a lot of value in a culture that in many instances really performs well. Unfortunately, it's part of America's skepticism about institutions. So we've inherited this through the generations, and it served us well. Gary Wills wrote a great book on this called The Necessary Evil, just the history of Americans' cultural suspicion of large institutions and public institutions. But when it's directed personally at the people who actually protect us and perform these functions, I find it completely unacceptable. They need our support. They're our friends and neighbors, and they support all of us, not just in the function of their job, but they go to local restaurants and stores and they contribute to the local economy, and many of them serve in other ways in the community. So I just think that particular thing is something that, quite frankly, only somebody who has sociopathic tendencies would do to other people. Next. So our office will remain open. Thank you to everybody. I do want to thank my staff here in DC. I thought this was a good idea, but it's 9 o'clock East Coast time. They work long hours, and also my staff in the district in the Walnut Creek office. Thank you, everybody. Just another reason I'm proud to represent this community and proud to work with the wonderful people that are in our offices here in DC and the district. So with that, we'll go to questions. Thank you all for joining us.
Thank you, Congressman. We will, as mentioned, we'll now move to the question and answer portion of our town hall. As a reminder for those in attendance, if you would like to ask a question, please use the Q&A function at the bottom of the screen on Zoom or submit your question in the YouTube comments. That said, let's start with our questions. The first is from Joan. Do you know that federal employees are again pawns in the budget game? My son just got notice once again to prepare for the shutdown. This is so unfair when they have no control when it comes to passing the budget.
Yep, I absolutely agree. I mean, I just concluded with those comments. We meet with federal employees. If there are any listening, please contact our office. We want to hear your stories. We can do them anonymously. We can do them confidentially, but we've met with federal employees. We've met with federal employees here, obviously, but also in the district. Region 9 is the country is set up into different regions. Region 9 is headquartered in San Francisco, so there are a lot of federal employees in the Bay Area and in my district. Of course, they're all over the country. And if you remember, during the first Trump administration, Region 9's Environmental Protection Agency was a particular target of this president. And I know a lot of people who work there, having been involved in environmental issues all my time in office. And it's just awful. So please have you contact our office. We can help facilitate. If he lives in our district, ethics rules will, of course, allow us to serve people in our district. They're different. You need to live in the district, but you are, as a resident of our district, please contact our office. We'll hear what you have to say and see what we can do to protect them. There are very rigorous efforts to protect them, but they still go through this awful period, and we can't tell what will happen in the courts. There is a nonprofit entity that's done great work on this called Democracy Forward. I've mentioned it before. We did a town hall with their executive director. It's nonpartisan nonprofit that coordinates the legal efforts. And in this instance, they've been very helpful with things like what your son is going through. There's a process to lay off or furlough employees in the federal government. And this administration, as a senior member of the Labor Committee and as a former chair of the State Senate Labor Committee, they are not in these efforts complying with federal law. So let us help you, and I'm really sorry, but it's outrageous, and Americans should be outraged by this, as I am.
Absolutely. Absolutely. Next question is from Claude. I know that federal employees who are in DC will be impacted by a shutdown, but what can Californians expect?
Same. So there are a little under 10,000 that we get from the analysis we have in our district, which is most of Contra Costa and part of Alameda. We don't have West Contra Costa County or the northern shoreline, but we've got from the eastern border, except for Discovery Bay, through the 24 and 680 corridor. So there's 10,000 that we estimate, a little under 10,000 federal employees who will be impacted by this effort. And they've already been impacted, as I've said, from the previous 4 years of his administration. We were rebuilding during the Biden years, and now it's going back down again. And I know people have worked in these agencies for a long time who I've known for many years, and it's just devastating. And then trying to get young people like your son to go into this kind of work makes it harder for us to recruit people. Us being the federal government.
The next question is from Noel. What is the expected impact on the US Postal Service?
Well, again, they have their own budget. The Congress has put them off of the general fund budget of the United States. So that is a good thing. They'll be able to continue to operate. So that's a really, I mean, the US Postal Service is quite remarkable in how it's developed and adapted to very changing times. I mean, we send emails now. The US Postal Service was started up the founders of this country, so actually before them. So they will continue, but again, they'll have pressure because of the other effects on federal agencies, but they should be fine. At least for a short time.
Sorry. The next question is from an anonymous attendee. How does the administration plan to reconcile a GOP-caused shutdown with the threat of sending troops into blue cities? Also, how would a shutdown affect ICE operations?
Well, it's amazing as somebody who believes strongly in fiscal responsibility. I mean, in the restaurant business, I was sometimes accused of being a numbers person. I like doing profit and loss statements. I think I'm good at it, or I was told I was. So why would you say you're trying to manage the budget when in your big ugly bill, you just added $3.5 trillion to the federal deficit? Why would you spend money on sending troops into American cities that has little or no impact on public safety? There are anecdotal stories right now and some research that shows it's had an impact. That's good, but we haven't talked about the cost of that. We should be hiring more qualified police officers. It's hard to get people to go into that work now for a variety of reasons. There are some great people out there, but this is one of the goofy things with and the hypocrisy, quite frankly. Well, it's lying. It's not hypocrisy. Where you're saying you want to help with the deficit when you're the ones that are adding to it with this fiscal irresponsibility and sending resources, in this case, ICE and troops, National Guard and federal employees in to supposedly protect people in dangerous cities. I mean, I'm in DC, I walk around DC. Are there neighborhoods in DC that I wouldn't walk around? Yes, absolutely alone. But this is just another fallacy by this administration, and it's fiscally irresponsible. And what just on ICE, this is one of the big things of the last 15 years. We've had multiple efforts at bipartisan immigration reform, including strengthening the border, putting more money into, but also giving a period of time for people to be able to apply for citizenship, go to work and show that they can be here. Every time it's happened, Mr. Bannon and Mr. Miller during the Trump years have blown it up. And even before that, um, former Speaker Boehner talked about when he was here, I got here, he was speaker, the process of the Freedom Caucus, the very most rebellious of the Republicans, in my view, coming in and saying we don't want to vote on immigration reform. There's been multiple efforts of it. So here's ICE trying to pose itself on a situation, and illegally, quite frankly, honestly, in many instances, on something that the Congress and the Republican Party created by not working with us to pass bipartisan bills. If you look back to the term before I got here, there was a bill called for the Gang of Eight. It was Rubio, John McCain, when he was here as a leader, and then Schumer and Durbin, the Democratic leaders. They were four of the eight bipartisan leaders. When it came over to the House, Speaker Boehner tells a story in his autobiography, about how a few members of their caucus, Republicans Mark Meadows, came into the speaker's office and pleaded with him on his knees because they didn't want to vote for it. So if you don't believe me, believe John Boehner. They have this been a deliberate attempt to divide the country and cause all this division based on racial bias and prejudice.
The next question is from Robin. Do you have any news about about continuing Medicare telehealth, which expires today?
Yes, that's another huge problem. And I was talking to some people from the Medical Association today, and hospitals, therapists, physical therapists, and it's a real concern from them. This is a wonderful tool that we should be using. We worked on a lot during COVID because patients like me and others being able to use that. And if you're in remote areas, I was talking to the therapist lobbyist today. If you're in Alaska, a lot of these people have to get on a plane to get physical therapy because it's so remote. So telehealth in a Republican controlled state like Alaska is interesting, it's just anecdotal, is a real problem. So think about how important telehealth is and how we've really made good progress on this. I take some credit for being involved in those discussions, both on behavioral health and medical health. It's a wonderful way for people to get services efficiently and effectively, and we can make sure that we have oversight so it's not abused. Now, will there be abuses? Are there abuses? Certainly, but the margin of error is actually smaller than on regular doctor's appointments, and people feel more comfortable doing it. And then again, it's more efficient because you're not going to the emergency room by letting things go and go until your condition gets so bad that you end up going in an ambulance, which is very expensive for all of us.
Thank you. The next question is from Ellis. How will a shutdown end? What are possible scenarios?
It gets really up to the American public and to us, but knowing this institution, there has to be pressure. So the next few days are going to be really important. If Americans respond the way they have so far, where the blame is purely where it should be, which is on the majority party, they control both houses, they control the White House. Now in the Senate, they need 60 votes because of the filibuster rule. So that's why we're going in a shutdown, because they can't slam this down our throat. The big ugly bill they can for just a process on reconciliation. But that's how they get that done. So and I'm repeating myself, but I voted against this last time. I'm voting against this time. I'm willing to work with people if they want to work in good faith. But this is just awful. So how does it play out? I think the American public, if they continue to place the blame where it's supposed to, then the President of the United States and the majority leadership will pick up the phone and start talking to us. Right now, they're not talking to anybody. They haven't talked to leadership, and they're not here today. So I would be talking to them and telling them what I think to their faces, but they're not here because this was scheduled by Speaker Johnson these 2 days, and then he canceled them. So they didn't come back, but we came back to say, well, we're here. We want to work. I'm happy to stay here however long it takes to make sure that we don't have this fiscal calamity that results in real suffering.
Thank you. The next question is from Lauren. Could you please remind me why the Republicans need Democratic support to pass their budget bills? Do they require 2/3 majority?
I just explained this. Thanks for the question. I'm sorry. I was anticipating it. They got it out of the House because that thin margin, every Democrat voted against it. So that's how it moved over there. But in the Senate, the rules in the Senate are, in this instance, it needs 60 votes. So they need 8 Democrats. Well, they need not those votes to get to 60. So the math of it. They're 8 short. So they had 2 Republicans with us, I believe, last time. I'm getting the numbers mixed up. But that's the reason, is that it's not a simple majority in the Senate, requires 60 votes.
Awesome. Next question is from Marissa on YouTube. What happens to furloughed employees if this goes on an extended amount of time? Are they able to get any kind of financial assistance?
Well, yes, it depends on who you are. If you've got a labor contract, what the conditions on those contracts are, if you're in management. So if you have questions specifically, contact our office and we will do our due diligence and explain it individually. But there are recourses, but it's not gonna, people are going to get hurt by this. But I would encourage any federal employees who live in our district to call us. If you live outside our district, it's an easy way to find out who represents you in the House. And of course, the 2 U.S. senators, Senator Schiff, and Alex Padilla. You can call their offices, but I'd call the House offices. And it's an easy way to find out. You can go to the House of Representatives, and it's easy that you just put your zip code in. It'll tell you who represents you and contact that office. If it's us, we will look into it, the specifics of your case, and find out what's available for you. And we're working too with state agencies too, to make sure that they are helping us as well for layoffs.
The
Furloughs.
next question is from Mary. How can Congress step up to prevent this horrible deployment of troops to American cities? And we need hearings on the deaths that have taken place in federal immigration detention facilities and into the detainees who have gone missing.
So we've got to win elections, folks. I mean, in this kind of environment, the majority rules, and they rule very harshly to allowing us. So we can ask for hearings, but they basically said no. We can ask for oversight, but we can't get those. When we were in the majority, we did a lot of robust oversight. I was in the oversight committee for 8 years, which has broad jurisdiction, and each committee has jurisdiction over the oversight of those agencies that come with them. So educational labor, in the case of that committee that I'm on, transportation infrastructure has a broad portfolio on all that. I'm also the ranking member, which means I'm the senior Democrat on ethics. That's tries to deal with the ethics rules of individual members and staff, and I'm very proud of that position. But we can't call hearings. Only the speaker can do that in the House, or approve hearings. We can do what's called shadow hearings, where we just go off on our own, which is one of the reasons I do so many town halls, is they can't stop me from doing town halls or these kinds of events. We're going to do a healthcare town hall within this week with the healthcare providers in Contra Costa and Alameda. So Kaiser, hopefully, Kaiser, Sutter, excuse me, John Muir, the county. We're going to get all of them together and have a roundtable to talk about, okay, what are you doing? How are we dealing with this? And I've met with all of them prior to this. I've spent a lot of time with the county over the now almost 5 years of the Trump administration. I had spent a lot of time with them anyways. As somebody who spent 4 terms on the county board of supervisors, I have great respect for that family. They do a great job with not enough revenue. So we will continue to work to try to figure out how we can diminish the impacts in the district. And I've had multiple meetings on this where I've had to tell folks the truth, but we're not going to be able to help you much. But we want to be here to convene and find out, get your stories, and tell the American public what's happening in our part of the country and share that.
The next question comes from Amy. Is the John Muir National Historic Site still going to be shut down? Will other federal sites, parks and monuments, etc., in your district be shut down?
Watching show the NewsHour, favorites, she's also attacked. on PBS, and they were saying that the National Park Service still hasn't developed a plan. So that's almost 2 hours before they shut down. That's because of this administration. I'm sure there are lots of great people who work in the National Park Service. It's not their fault. It's the orders they're getting from administration. So I don't know, but I would, before you go, check to see if they're open, and I'd sort of plan on them not being open, which is awful.
The next question is from an anonymous attendee. How are international travelers entering the US impacted?
Well, it's going to be hard. We do a lot of passport work for people who need a passport quickly, but it's going to be hard because it's just going to be hard. It's going to be hard to process people coming in and going out. Now, all the basic services, as I mentioned earlier, will function. So we'll see. But if you don't have your passport, it's going to take longer to get it. And we're happy again if you live in our district to facilitate that, but it'll take longer for us as well. So for international travelers coming, so if you've got friends coming, I just tell them to be ready. It could be fine because the functions, as I mentioned earlier, the functions of aviation are continue to be funded, but all of these things have impact. So it should be fine, but it might be slower and it might be worse than that. But contact our office if you get specifics, and we can work on that. But if you've got international travelers coming here, I would expect that they shouldn't be surprised if there's some interruption, but most of those functions are continue to be funded.
From Patricia, if Trump does fire the furloughed employees during this time, what can the Democrats do to stop this? I fear that even if this is ruled illegal, Trump will go ahead and fire anyway. Once fired, I doubt most would come back to work.
We're ready, and we've gotten much better at this. I mentioned the Democracy Forward. The Brennan Center for Law is another really good nonprofit, nonpartisan, who works with us in this instance and anybody who's interested. So we'll be ready in court, and a lot of partners here are ready to go to court for the employees. And of course, a lot of these people have very strong labor unions who are very savvy at this, and they'll be there too. Now, again, I'm not trying to sugarcoat this. This is going to be awful, but there are remedies. But it's within the Constitution of the United States that we're pushing very aggressively, and we're pushing against somebody who doesn't believe in the rule of law or believes that it doesn't apply to him and this administration. So we're being as aggressive as we can be. We're being aggressive, but we're also trying to maintain respect for the institutions to get them through this. So this is hard, but we got to fight. We got to fight like hell. And this is completely wrong. And you can have my assurance that I am now and going to continue to fight as hard as I can with every fiber of my bone to stop this stuff. Let's get back to a two-party functioning system. The Republicans, pro-business, right of center, Democrats traditionally described as left of center, and want to believe in our social contract with one another. Having been a Republican and now a Democrat for a long time, that system works when we adhere to the law and the spirit of the United States Constitution. It doesn't, obviously, when you have people who don't and think it's okay to cheat. But the courts will be there. It's just the due process takes a long time. And I have serious doubts about the integrity of the Supreme Court given their most recent decisions.
The next question comes from an anonymous attendee. How can we get legacy media to start reporting on these egregious moves as illegal and unethical instead of normalizing the actions of the administration?
That was a great question. I would go to trusted people you trust. I mean, what's happened in the media in my lifetime, Reagan did a lot to this when he eliminated the equal time clause. Now the world has changed with streaming, but that was a requirement to get your license from the Federal Communications Commission, that if you did something that was too partisan one way or the other side got equal time. We did away with that, and it's been a slow erosion ever since. And the integrity of journalism has changed dramatically. groups like Fox it's basically entertainment, but derived at a particular viewpoint that serves the owners and the investors in that particular network. On a national level, I still have good relations with a local Fox affiliate, but I struggle with them sometimes because of who's calling the shots nationally. So how do we get legacy to get back the way we want it to be? I think that's, again, people have to demand it. And for me, journalism is a priority to me. If you don't have that professional journalist in the front row, however flawed they could be, journalism is really a sacred form in our country. And when you think about how this country started, it was the written word and literacy, the Stamp Act, which Americans were violently against because that's how they communicated. Now, was that all journalism? No, but pamphleteers I mean, Benjamin Franklin, one of my favorites. He worked for his father's print shop in downtown Boston. I used to walk by it regularly. So all of this professional journalism is changed dramatically. It's very subjective, and the algorithms are tied in real time to their advertising rates. So they know more about you than they should know. We've got multiple efforts to rein them in for privacy acts. They're immune from civil litigation largely, just like the gun industry is. And I would like to change that. They should be subject to a reasonable day in court when they distribute falsehoods and make it harder for us to have an honest conversation. So Veritas, the Latin word for truth, I mean, it's really important, obviously. So having professional journalisms and the erosion of professional journalism is a real danger to democracy. And I spent a lot of time on this at journalism schools and with professional journalists. Do I always agree with them? No, that's the nature of things. How do we get legacy to report more evenly? I think that's for us to demand it. We should only go to people who do that. Now, I know that seems simplistic, but the other way is for Congress to change. We should go back to a form of the equal time clause. We should allow or require licensing, like we did for radio wires or radio system or TV for social media. We're out of control on how we get information. And to me, that's sort of the basic problem here is getting professional objective reporting is one of the things that's really been a tragedy of this country in my lifetime. And local news.
The next question is from Steve on YouTube. What are examples of important bills you and some of your fellow Democrats have voted with Republicans? Will you work with Republicans on anything in the future?
Yeah, so I'm proud of some of the bills I've gotten passed here with Republican support. Family engagement centers is something I did with Glenn Thompson, who's on education with me. A program that's now over $100 million, recognizing that parents are busy and schools need to have the staff and the facilities to make two-income households be able to be part of their kids' education. So I'm very proud of that. There's a number of them. There's all on the website now. Have we been able to do it since January 20th? No, we're still having conversations, but very little is getting passed. The transportation infrastructure bill, we did that during the Biden administration, but we worked with the Republicans. I'm a senior member of the Transportation Committee. We pride ourselves on that committee as being the least partisan. I got a lot in that bill, but now we're fighting to get it distributed. So did a lot on federal aviation to reauthorize that. I'm proud of what I did. Safe Landings Act have changed a lot of the technology and how we staff because of an incident at SFO where we almost had a tragedy. So those are some. We are currently working in TNA, Transportation Infrastructure, on reauthorizing the highway and transit part. So we're working together on that. The chair, Sam Graves from Missouri, I don't agree with him on these, but we get in that room, we roll up our sleeves and work together. Important bill that I got passed in the reauthorization, we were in the majority. It's called the Clean Corridor Act. It's billions of dollars to get electric chargers into the infrastructure. And I'm very, very proud of the work we've done, but now this administration is trying to stop our transition to EVs and alternative fuels, which I've been involved with since I was on the California Air Resources Board, appointed in, I think, 1994. So those are just some examples. We've got more. If you go to our website, you'll see them.
I think we have time for just one question, depending on the answer. This is from an anonymous attendee. I'm worried that the administration has tried to put a target on the back of transgender Americans, including via a CR, which would totally deny them care. Will you stand up for them?
Absolutely. This is another awful, divisive thing that is just cruel and completely lacking in understanding. I have four siblings, two of them I've love dearly, but they've been in same-sex relationships and marriages for years. I've seen how hard it was for them to live their lives and how wonderful and full their lives are. I'm gonna get emotional. So when it comes to transgender, we need to reach out, understand, and support people who are going through these very, very difficult decisions and have some empathy and some compassion, understanding. So that's just my feeling, but I will fight, given my history in this subject matter for a long, very, very hard. It's incredibly cruel.
We can do one more question.
I tricked you. I actually was
I know.
succinct.
I'm happy that we can do
Go.
one last
You-
question from Chris. Has litigation enforcing the Impoundment Control Act been successful in getting Trump to free up funds he has been withholding to various entities such as universities?
Yeah, so actually there's a good decision just today on UCLA. I believe it was today, maybe tomorrow. As a senior member of the Education Committee, I visited a lot of these colleges. I'm on the higher education subcommittee of that committee. I just was down there and I take a lot of these trips on my own. I pay for them myself. And met with a really important one today. UCLA has this remarkable behavioral health emergency room that's sort of state of the art that I've supported and been interested in when I've been able to at the state and federal level. That's at risk. So that's going to go forward. It's right next to their emergency room. If you have behavioral health problems and you're near that particular facility, which will be a model for the whole country, you'll be able to go walk into a state-of-the-art behavioral health facility and get a diagnosis and get treatment and get on a treatment plan. We should have that all over the country. We have some great providers in Contra Costa and Alameda, but that's an example of where he was impacting by his empowerments. Also met with the chancellor and encouraged him, the new chancellor of UCLA, as I have with UC and others, to not give in, to fight. So there's an example of one, very big one, that we and our partners and the university have been successful at stopping. So as a senior member of the higher education subcommittee of the educational labor, this particular interest to me of these empowerments to research facilities. The world envies us for our public research. And a lot of that goes through places in our neighborhood like UCSF, UC Berkeley, Stanford. All of that money at a federal level goes out. And we're just remarkable, life-changing things. And I am an example of that. 15 years ago when I was diagnosed, my doctor, 10 years ago, said 15 years earlier, if it wasn't for those investments, there was nothing they could do for a stage 4 CLL patient. Now, because of taxpayers' investment in the brilliance of our researchers in America, in my case and in many, people can live a normal life expectancy at their full health. So these cutbacks and the success of us overturning them, they take a while. This is arbitrary approach, and it's just so unrecognizable in our history, at least our modern history. And the courts have been coming in through, but not always, and we've got to rely ultimately on the Supreme Court in many of these cases. So we've just got to stay at it. So no time for one more. I carry that one too. And also,
No,
you can do some research online to see where we've been successful. Again, Democracy Forward is really a good venue for the court challenges, and the Brennan Center for Law.
yeah. Any closing remarks, Congressman?
I just want to thank you all for joining me, us, and it gives me fortitude when I'm back there with you folks at town halls and out in the streets. I really, it's an honor to be here. It's not an easy time to be a member of Congress in the minority, but I also want to recognize my terrific staff, Janessa and our staff in the district, and my wonderful staff here that have kept up late. in the Capitol. So I want to thank them, but I want to thank you too for the great honor of being here. And I'm not going anywhere. I'm going to fight like hell. I want a better day for this country. I want a day when we can get back to having civic passion discourse without the cruelty and the violence and the nastiness that is largely derived from Pennsylvania Avenue down the street from me. It's an important responsibility to be president of the United States, and it's an important responsibility to the member of Congress. These are trying times, as Payne said when we started this country. But it's also, as Payne said, this is no time for sunshine patriots. We have to stick at it and keep working and being diligent and forceful and fight when we see these egregious violations of federal law and the spirit and the law of this country. So thanks so much for joining us. If you have questions, let us know. We're going to be here through this, but we have to stick together and we have to fight this. And lastly, I have this to remind me of a difficult time in history. This is hung up in my wall. If you can read it, it's Winston Churchill. And it says, if you're going through hell, keep going. So I will conclude there. Thank you all for joining us. And again, thanks to my terrific staff.
Absolutely. Thank you, Congressman. The town hall will be available on our YouTube and Facebook page if you'd like to watch it again or share it with your friends. Please do not hesitate to call our office if we can be of any help to you. Thank you again for joining us today.